Today we discuss about the mechanisms of action of the acetazolamide. This is a acetazolamide. We know that the acetazolamide is a weak diuretic, and this drug is mainly used for the diuresis. But this drug is also used in a high mountain sickness, and this is a carbonic anhydrase inhibitor drugs. Before discussing about the mechanisms of action of these acetazolamide drugs, we have to discuss about the normal physiology of nephron which take place at the PCT. Then let discuss the normal physiology of the nephron. Then we can see that this is a normal physiology of the nephron, where this is a tubular lumen. This is a lumen of the tubule, and this is a tubular epithelial cells. We can see that this is a tubular epithelial cells, and this is a interstitium, and this is a blood. As the fluid filtered from the glomerulus, it comes into the Bowman capsules, and from the Bowman capsules, it enters into the tubules. Among the filtrate, there is also presence of the bicarbonate. Again, as the fluid filtered from the glomerulus, it enters into the Bowman capsules, and among the filtrate, there is also bicarbonate. This is a bicarbonate ions, and these bicarbonate ions combines with the H ions. These bicarbonate ions combine with the H ions to form a carbonic acid. But there is a question how formation of formation of the carbonic acid occurred. For this, there is a presence of the sodium and H ions antiporter at the luminar surface. There is also questions what is the luminar surface? The surface which face toward the lumen. We can see that this is the tubule lumen, and this is a surface which face toward the lumen. That's why it is called luminar surface. And in the luminar surface of the tubular epithelial cells, there is a presence of the sodium and H ions antiporter. For from these antiporters, H ions enters into lumen with the exchange of the sodium ions. We can see that this is a H ions which enters into lumen with the exchange of the sodium ions which enters into the tubular epithelial cells. Then as H ions enters into the lumen, this bicarbonate and H ions, again this bicarbonate and H ions condense to form a carbonic acid, and this carbonic acid in the presence of the carbonic anhydrase 4, again this carbonic acid in the presence of the carbonic anhydrase 4 can break down into the water and CO2. We know that the CO2 is a lipid soluble. We know that CO2 is a lipid soluble, so it can cross the tubular epithelial cells of the nephrons. But water is not a lipid soluble, so it enters into the tubular epithelial cells by a paracellular pathway. After this CO2 and H2O enters into the tubular epithelial cells, combines to form a carbonic acid. But how? In the presence of the carbonic anhydrase 2. After entering CO2 and H2O in the tubular epithelial cells, this condenses into the carbonic acid in the presence of the carbonic anhydrase 4. After that, this carbonic acid again break down into the bicarbonate and H ions. This is a bicarbonate ions, and this is H ions. and this H ions is exchanged with the sodium ions. Again, this H ions is exchanged with the sodium ions through the sodium ions and hydrogen ions antipodes. So this H ions is able to combine with the bicarbonate in order to form carbonic acid. So this H ions is able to combine with bicarbonate in order to form carbonic acid, and sodium ions which come from the lumen into the tubular epithelial cells. This is sodium ions which come from the lumen into tubular epithelial cells is exchanged is exchanged and along with the bicarbonate ions enters into the interstitiums. These sodium ions and this bicarbonate ions enter into the interstitium by a sympater called sodium ions and bicarbonate ion sympaters. Okay, then after entering into the interstitium, these sodium ions and bicarbonate ions enter into the blood. But there is a question how these sodium ions and bicarbonate ions enter into the blood from the interstitiums simply by a which is made by ultrafiltrations. These sodium ions and bicarbonate ions enter into the blood by a ultrafiltrations which is mediated by the colloidal and hydrostatic force. This is a normal physiology of the nephrons which take place at the PCT. Then, what is the mechanism of action of the acetazolamide? Then, this acetazolamide drugs, we know that this acetazolamide drugs is block the carbonic anhydrase inhibitors. We know this acetazolamide drugs blocks the carbonic anhydrase inhibitors. So if this drugs blocks the carbonic anhydrase inhibitors in the lumen, there is no formation of the carbonic acid because there is no condensation of the bicarbonate and H ions. So there is no formation of the water and CO2. So if there is no formation of water and CO2, there is no formation of the H ions and bicarbonate ion. If there is no H ions in the tubular epithelial cells, then these H ions cannot enter into the lumen in exchange with the sodium ions. If these drugs block the carbonic anhydrase inhibitors, then there is no this action take place and there is no H ions in exchange with sodium ions in order to enter into the tubular lumen. Means there is a remains of the sodium ions in the lumen and remains of the H ions in the tubular epithelial cells. So there is no exchange of the H ions with sodium ions. That's why these drugs leads to the metabolic acidosis. That's why these drugs leads to the metabolic acidosis because H ion remains in the tubular epithelial cells and sodium ions remains in the tubular lumen. So these drugs leads to the hypokalemia and metabolic acidosis due to the remains of the H ions in the tubular epithelial cells. Has then again questions how these drugs leads to the hypokalemia. होइन, we know that these drugs leads to the hyponatremia because there is remains of the sodium ions in the lumen. होइन, then how these drugs leads to the hypokalemia as these sodium ions goes to the collecting duct of the lumen, then there is the presence of the sodium epithelial channel at the luminal surface of the collecting duct. Through this channel, sodium ions enters into the epithelial cells. Again, through the as the sodium ions from the PCT enters into the collecting duct, this sodium ions enter into the tubular epithelial cells of the collecting duct by a channel which present in the luminal surface of the tubular epithelial cells. So by these channels, this enter into the cells. So due to which it create negativity in the lumen of the collecting duct, due to which it attract the potassium ions into the lumen. So it leads to the hypokalemia because there is negativity due to movement of the soda ions into tubular cells, and due to which it attracts this potassium ion through the potassium channel. We can see that this is a potassium channel. So potassium channels, sodium potassium enters into the lumen from the tubular epithelial cells, which come from the sodium potassium ATPase pump, which present on the basolateral side of the inter system, that's called basolateral surface. Due to this, it leads to the hypokalemia, loss of the potassium ions in the urine. And we know that it leads to the metabolic acidosis. There is explanations, as there is no H ions for the exchange with the sodium ions. There is mentioned, as there is no H ions for the exchange with the sodium ions, so there is accumulation of the H ions in the tubular epithelial cells that leads to the metabolic acidosis. And this is today explanation of the acetazolamide mechanism actions, and this is the most important topic which asks in the board examinations and favorite viva questions. Finish.